CityNews has confirmed the Edmonton father of three who died in this emergency room just days before Christmas was one of three people who died in the Grey Nuns ER that day, and Alberta doctors are sounding the alarm.
In August, our Edmonton hospitals were at 100 to 113% capacity even before the flu hit. We already had 20% of patients, 15 to 20%, leaving emergency departments in Edmonton without ever being seen.
Edmonton emergency room doctor and former Alberta MLA Raj Sherman telling CityNews the province's ERs were overloaded long before the death of 44-year-old Prashant Srikumar. The father of three went to the ER for chest pains December 22nd. His wife sharing the heartbreaking news that he died after waiting 8 hours to be seen by a doctor. Covenant Health unable to comment on the other two deaths at the Grey Nuns that same day. Dr. Sherman agreeing with other emergency room doctors calling for a state of emergency, saying part of the issue is hospitals are backed up with patients that shouldn't be there.
Our ER department is plugged by admitted people who should have been upstairs yesterday, and upstairs is plugged up by a lot of sick people. And in the Edmonton zone, we have 650 people who aren't sick, but they're fragile elderly folks who are plugging up acute care beds.
Alberta's Ministry of Hospital and Surgical Health Services admits this has been a difficult flu season. They tell me through a statement they are working to add capacity, including 336 new emergency beds in Edmonton area hospitals for flu season. Adding Alberta has had some success in reducing the number of patients in hospital waiting for a bed in a long-term care facility, down 22% since September in Edmonton. The ministry going on to say, quote, "To ensure Alberta's healthcare system has the capacity it needs now and into the future, we are taking decisive action through the Acute Care Action Plan. This includes planning for 1,000 additional acute care beds with new bed towers at South Health Campus, Misericordia Hospital, and the Grey Nuns Hospital, and investing in community care spaces." But Alberta's opposition NDP laying the blame squarely at the feet of the provincial government, saying controversies around AHS leadership have distracted the province from running healthcare.
And it's mostly probably entirely caused by the chaos that's being created by Danielle Smith and the UCP, focusing more on trying to cover up scandals and hiring and firing than on actually focusing on the front lines and getting care to the people who need it.
Alberta has launched a review into the death of Prashant Srikumar. Reporting from Edmonton, Darcy Ropchan, City News.